Parenthood is considered to be a blessing by many, but what should a woman do if her experience of motherhood is shrouded in negative thoughts? Mental illness are considered taboo in Pakistan, and many people end up suffering in silence due to them. In Pakistan, only 0.4% of the healthcare budget is allocated to mental health services. Furthermore, there is a huge stigma attached to mental illness. Mental illness are often attributed to supernatural reasons, and the sufferer is often taken to a religious healer instead of a doctor or a psychologist. This is in part due to limited awareness regarding the slow literacy rate and lack of access regarding mental health services. One of these mental health illness is postpartum depression. Postpartum depression is highly neglected issue in Pakistan. Most cases go unreported because women experience shame and guilt in discussing their symptoms. Their families are also sometimes unsupportive of them seeking help because they want to keep the issue hidden. However, postpartum depression is treatable. No one deserves to suffer in silence just like other mental illness. Suffering from postpartum depression is not a moral failure. It does not mean that someone is a bad mother or that she does not love her child.
Postpartum depression is a type of depression that occurs in mothers shortly after the birth of their child. During this, women experience hormonal, physical, emotional, financial, and social changes. It usually begins within 6 weeks after birth and may last up to a year. Women suffering from postpartum depression may experience trouble in controlling and expressing their emotions. This may lead to frequent crying, irritability, anger, and severe mood swings. Patients may also have a disturbed sleep cycle and may develop insomnia. On the other hand, they may experience extreme tiredness or loss of energy, and it may cause some women to sleep too much. They may also experience frequent depressive episodes where they withdraw from the baby and their family. They may derive less pleasure from the hobbies and activities they once used to enjoy. Besides this, they may experience difficulty bonding with the baby and may feel inadequate as a mother. It not only affects the mother, but it may also affect the baby. Babies born to women suffering from postpartum depression have poor health, frequent diarrhea, may also be underweight, and they may cry too much. Furthermore, these babies may experience difficulties with sleeping and eating. Their language development may also be delayed. In severe cases, mothers may think about harming themselves or the child. Due to this, infanticide and suicide of the mother may also occur.
Reliable statistics regarding postpartum depression are difficult to obtain due to problems such as lack of reliable screening tools and underreporting. Despite this, postpartum depression is common among women in Pakistan with a frequency ranging from 28% up to 63%. According to this, Pakistan has the highest rate of postpartum depression in Asia. In Asian countries, the frequency of postpartum depression ranges from 3.5% to 63%.
Many people in Pakistan still prefer a boy over a girl. Therefore, some mothers may feel sad and stressed at the birth of a girl instead of a boy. Social factors may also contribute to this. A poor relationship with your in laws, low socioeconomic status, illiteracy, and having a large number of children may also contribute to postpartum depression. Due to these reasons, a mother may be unable to properly provide for her child and may become depressed as a result. A woman experiences many hormonal changes after the birth of a child. Melatonin and cortisol imbalance may also cause the appearance of symptoms such as insomnia, sadness, and mood swings. Women who are being abused by their partners may also be at a high risk of developing postpartum depression. It is also more likely to be experienced by women who have minimum social support from their family with raising the child. Women who had a difficult pregnancy and gave birth prematurely are also at a high risk of developing postpartum depression.
One of the best ways to reduce or prevent the occurrence of postpartum depression in mothers is to educate all women of reproductive age about this. It can be done in universities or workplaces. Risk assessments can also be done during pregnancy if some has a family history of mental illness, is showing symptoms of depression, or is appearing stressed. Cognitive behavioral therapy is used in psychological setting to treat postpartum depression. Besides this, interpersonal psychotherapy is also used. Therapies can help a patient to better understand and manage their emotions. A therapist can also teach the patient relaxation techniques to regulate the emotions. Besides this, counseling sessions for the couple or for the entire family can also be conducted in order to smoothen the role transition that occurs during motherhood. Clinically, the Edinburgh Postnatal Depression Scale and the Patient Health Questionnaire are used to test for this. Besides this, the self reporting questionnaire is also used. Exercising for at least 30 minutes has also been shown to manage symptoms, especially during aerobic exercise, is particularly helpful. Improving diet and managing sleep is also helpful.
The best way to break the stigma regarding mental illnesses is to humanize the people suffering from them in the eyes of the general public. This can be done by creating awareness in the public through campaigns, workshops, and ads. The aim is to get people to treat mental health issues like an illness, just like diabetes, something that can be managed with the proper treatment. Moreover, systematic change is also required. The government should focus on introducing policies that prevent discrimination against mentally ill individuals in educational institutes and workplaces. Besides this, another way to reduce the stigma is through social contact. If a prominent figure publicly admits to having mental health issues, it humanizes the victims as people are able to put a face to a mental illness and are less likely to stereotype the victims. Additionally, if a famous or high ranking person advocates for mental health, people are more likely to accept the message. Lastly, people should be encouraged to share their recovery stories so others can realize that there is hope for people suffering from mental illnesses. In the end, people suffering from mental illnesses deserve empathy and compassion, and those seeking treatment should be encouraged, since it takes a large amount of courage to seek help.